Hi everyone, my name is Asad Khan. I'm the CEO for TruDoc, and this is going to be the first of many podcasts in a series on healthcare. So healthcare, not just in Middle East, healthcare all over the world is going through a massive transformation. So like all other industry before healthcare, financial services, retail, food delivery, for example, I think healthcare is catching up fast. So we will be looking at different topics within healthcare, but focus on digital healthcare. We are lucky that for our first podcast, we have a very special guest with us today, Dr. Jameel. Dr. Jameel, if you could please, briefly tell us about yourself.
Yeah, my name is Dr. Ahmed J Jameel. I'm an internist in background. I finished my training in Canada, and I start with Aramco and then Johns Hopkins. Now I'm the chair of Department of Medicine. Also, I work as a senior medical advisor for the chief of staff. I held multiple positions, mainly running projects for improve the service, access to care, and also give me the opportunity. I run the project for the home hospital at home and visit after working hours, which is the televisit where we have.
Fantastic. So you have seen the whole evolution of digital health,
Yes,
as we say.
yes,
So
yes.
maybe we can start from that from KSA perspective, from Saudi perspective.
Yes.
So how important is digital healthcare in regards to Vision 2030?
Yeah. Digital healthcare is very important for the Saudi peoples because the Vision 2030 put three things in their vision for 2030. One, hospital at home, which is a virtual hospital, they call it, home care, and a televisit, which is you can visit your physician while you are at home, so which is a televisit. So those is built in Vision 2030, and I believe the kingdom is moving to achieve this one because each one has its own benefit for the patient and for the healthcare. I mean, you cannot spend more money in building more hospital. You need to utilize, be more functional, more proper, going to your patient at home and with the hospital at home, and even the visit, because people they go 100 kilometers for refilling medication or to visit their physician only to follow up the lab or to do things, which is, I think, over the virtual visit, It will solve all those problems.
So I think for the audience, people who are listening, so there are a lot of words within healthcare. So there is virtual ward, there is hospital at home,
Yes.
there's teleconsult, there's telemedicine.
Yes.
So when we talk about these services, I think you've coined a term, I think, which is a movement, which is beyond hospital walls for hospitals, etc.
Yes.
So I think just for the benefit of our audience, how do we define hospital at home from a hospital perspective?
First of all, we need to believe that our patient in their journey should all spend in the hospital.
Fantastic.
So part of their journey, I am in the healing process. I improve 50%, but the other, I need to have my antibiotics, I need to have my physiotherapy. Why I need to stay in the hospital? So you can continue your journey at home with the hospital around you. So you will have a physician visit, you will have your physiotherapy there, you will have the wearable, the blood pressure machines, the pulse, glucose check, even the heart monitoring with you at home. So for you, you will feel like you are in the hospital, but in your home. So it's to go back to your usual activities. This is where we break the wall. Number two, what I feel in the big cities, we cannot, for big organizations, they cannot build more hospitals and hospitals and hospitals. We need to be more for our customers, because our customers, they demand to be cared at home. They don't demand to be cared only in the hospitals, because around them the environment is good. Also for the geriatric people, they will not be confused with the hospital, because in the hospital you will get more confusion, more delirium compared to the home, where is your usual status. So we are starting this movement, and all over the world is starting the movement, and we need to continue this one, because if we didn't catch it now, it will lose it, and the people, they will pass, and we're still staying where we are. That's why I say it's a movement. It should move from hospital, in the hospital is to break those walls, and we go to home. So becoming the hospital at home.
Fantastic. So patient will be at home. So essentially we are saying that the crucial part of the journey, the crucial part of the treatment is in hospital, but then the patient can be home and will have exactly the same services, exactly the same facilities, doctor care, all of these vital equipment, etc., at home.
Yes.
So then it becomes the extension of hospital.
Yep.
So I think you've mentioned previously, examples from outside of healthcare settings, how companies have become the biggest in the world without having a single piece of infrastructure.
What I told the people is the biggest retail stores is Amazon. And Amazon, they don't own, if you go to every mall, you didn't find Amazon there. Now, if you ask any person, do you know Shein? Everyone buy from Shein.
Sure.
Everybody, Airbnb, the highest or the biggest hotel chain in the world, and they don't own any hotel because they use it as a virtual, as a cloud, and they use the home as a hotel, and the people, they put their home as a hotel.
Fantastic.
It's like the hospital at home. It's hospital at home. We use the home as a hospital, and we get all the support around it. The same for Uber, the biggest company for renting car, and they don't own any car, because the same people, they use their car as a rent a car, as a taxi, as Uber. So now we are in the game. If we didn't utilize hospital at home, it will pass. So this is, I think, is the era of hospital at home. It's the era where we need to have the hospital at home.
So it feels like you firmly believe that the hospitals or the healthcare providers now can extend their services or use their expertise to go beyond hospital walls.
Yes.
And use, patients' home or other places and go closer to the patients.
Yes.
And take the services there.
Yes.
Without having to build new buildings.
Yes.
And new beds.
Yes.
Yeah.
You extend your bed at home and extend your floor at home. So instead of building a building and maintenance and you do everything, if I accommodate 100 patients at home, it's like I build a 100-bed hospital, which is, you can imagine how much it will cost me to build 100-bed hospitals. You see, in Saudi, we have hospital 50 beds, 100 beds, then above. So how much those beds will cost if I do it at home? So only what is costing me is the support, where I get the wearable, and how I make it, the system, the digital system, how I can monitor them. Because now we're becoming monitoring them from far away, and you come and visit them at home. There is nurse, there is physiotherapy, there's respiratory therapy, and the doctors, and it's like the hospital because it's an encounter. This is,
and how do we see that as an exercise, which is, or how do we see that beyond purely a cost benefit exercise? So if the hospitals go into this hospital at home programs, then beyond just a cost benefit analysis, I'm sure the patient outcomes are as important, if not more important, than the cost.
The cost is important, but there is a health quality metrics. One, you are cutting. We start our journey with the hospital at home, and we admit almost 100 patients in that journey. What we found our readmission rate is low. So if the patient is go to the hospital at home and you continue follow him at least for 4 or 5 days at home,
sure,
and make sure he receive exactly the antibiotic what you prescribe for him, and you make sure the journey fixing the transition of medication when he was transferred from in-hospital to the hospital at home, will cut his readmission. If I cut the readmission, see how much I improve the quality. It means the patient health is improved. Going back to his community, if he has his physiotherapy at home, is continue with that one, I will bring him back to his usual condition before he's getting sick. So all those measurement of quality, we didn't measure it, but if we count it, it's value. So this value is high. So for me, as a quality, you are improving the quality. I'm not only looking for the value of dollars, how much it costs me. It's a care, and you reach the patient to his home and improve the care. This is what I feel.
So this is not a mutually exclusive. So either you reduce costs or improve outcomes. I think in this case, it sounds like you're achieving both.
Yes.
So you're achieving better cost outcomes, but you're also achieving better patient outcomes.
Yes.
With this program. So I know that I think Jaha pioneered one of the first hospital at home programs.
Yes.
In the kingdom. How have your experience been, especially from the point of view, let's say, from quality of services that Jaha provides inside a hospital, maintaining the same quality of service providing outside?
At Jaha, we look, first of all, we have a problem where we have we are not building a new building, and we continue with our status with the bed situation, which is our bed situation is sometimes getting almost 85 to 90% capacity. And we thought, why we need to keep the patient longer in the hospital if we can care for them at home?
Sure.
With proper care, proper sitting, proper environment. So we prepare and we start and we put the scope of service, we did everything. Then we start this journey. Okay. At the same time, our patient is involved because we cannot put them in the hospital at home without their permission because it's a new service. Yeah. So they need to be consented and they agree, and all of them they agree, and some of them they are so happy with it where they go. Then we grow and we grow. We start with 1, 2, 3, 4 patients. Now we cross that 100 patients. Today we reach 20 patients in the hospital at home a day, which is a big, if you count it, it's like a full floor there. You see patients, they are happy because before they thought it's a home care. It's not a home care. It's a hospital at home. I'm not doing nursing home. I'm not doing nursing. It's a hospital at home. It's a physician, nurse, pharmacy, lab, radiology. They go to your home and do it if you need it.
So
it's like an encounter. Someone will write notes, will do for your admission, discharge. It's a hospital.
No, I think you've So you have picked up on the most important point within healthcare, that in healthcare, the behavior change or accepting a new form of care is the hardest part.
Yes.
Because the patient buy-in has to be there. It's not like other food delivery services or other e-commerce services. There's a big element of changing patient behavior and convincing patient that this is the better form of service. Yeah. So I think over the last many years, many of these digital healthcare services, let's say telemedicine, now the hospital at home, teleradiology, etc. A lot of these services have evolved in silos. But I think as these services are evolving, they are pretty much becoming complementary.
Yes.
So hospital at home, for example, requires all of these services.
Yes.
So how do you see the evolution there?
I mean, before is everyone did it alone and everyone is working as alone. Now, all those ones coming all together and they work for your benefit as a hospital at home. So the physician will visit, but now the physician, he go to his headquarter, okay? He monitor the patient from his headquarter where they are sitting. As soon as change, he will do it's like a televisit or talk to the patient, okay? He's wearing the wearable, blood pressure is down, he will call him, are you doing fine? Blood sugar is going up, what's going on? His oxygen saturation is low. Now, you need an X-ray. You send someone to do the X-ray, then they will come, someone in tele, he will read it, then it will close the loop. Before is you do it for the hospital, the tele. You need a pharmacy, so you put your order, go to the pharmacy, it's like all digital. So the pharmacy with the pharmacist, with the nurse will go and give the medication. So it's amazing how you see it. It's like in the hospital, but it's in the home. So everything is, and there is someone is getting the master sitting in his control, what is they call the control room or the area where they have, and he's following all the names. So all the name is there. He knows when the flag, the color, red, yellow, black, blue, whatever, he will respond to that color. You do a check. If it's not responding with this time, is escalation. So you put the quality metrics, the check. So yes, you feel comfortable the patient is receiving his care. So you don't feel that, which is always hurting us when sometimes it's a home care or it's a hospital at home, this is where until now the people not grabbing this movement that is a hospital at home, because everybody knows a home care, nursing home care, nurse will come once a week. No, this is a hospital at home. It's just like a hospital. It's patient seen. It's in the home.
I think you have put it very aptly that hospital at home. This is bringing all of these services together.
Yes.
And is closing the loop.
Yes.
So instead of all of these services operating in silos, with hospital at home, you get hospital level care because you have all of these digital services, closing the loop and bringing all of these services seamlessly together to patients at home.
Yes.
So I guess the evolution of these services over the past 20 years has helped us, go to this direction where now you can get hospital level services at home because all of these services came together.
It's like a Lego. You have the Lego and you put each cubicle together. This is what you do. You did in the hospital at home.
Yes.
And yes, all of them, they are together, and the one who's closing the loop, because you have a physician sitting in the center. And this physician, he will make sure the radiologist who read the X-ray and there is abnormality, he can respond to it. So I will not wait.
Yes.
The lab who did it far away, result, I can act on it. I make the order to the pharmacy. I will talk to my nurse. I will talk to the physiotherapy. I put everything. So each time there is one sitting shift to follow those patients. So even sometimes you feel the patient as the hospital at home is more monitored more than in the hospital. Because in the hospital, the physician, they come and visit the patient, then he goes. He has no monitor to follow unless he come next day around, or the nurse will call him if there is abnormality. Because in the hospital, the gadget, whereas the wearable, where he wear it there, in the floor, the nurse will come and do the the vital signs every 6 hours or 8 hours. It depends what is written. Then she will call the physician. Here, if it's done instant, as soon the patient is click the blood pressure monitoring, if it's low, it's come in my monitor. Then I will see I need to act fast. And there is a physician almost 24 hours, he's following his monitor.
Fantastic. You get excited just hearing this. That there's so much that has, there's so much that has happened within the healthcare. Now we are putting these different Lego pieces together,
Yes.
which became available over the last 10-20 years.
Yes.
Dr. Jameel, thank you very much. Any parting thoughts from you?
Parting thought first, thank you. Thank you for this sitting with you, talking to you. It's good to sit with the friend and talk about it. I feel emotional about it. I feel emotional about the hospital at home. I feel this is the future and where we are going. I believe when they put it in Kingdom as Vision 2030, they didn't put it like this. I think they have a vision. This is the movement and this is where we are going. I believe on it. And I think we are making the future where we are going with the hospital at home. Thank you. Thank you for hosting us.
We are so glad to play a very small part
Yes.
in the movement for this. Thank you very much for this, for giving us time.
Thank you.
Thank you.
Thank you.
So this was our first podcast of the series. Thank you again, Dr. Jameel, who was with us. We had a fantastic discussion. I think the first podcast, I think just hearing Dr. Jameel about the potential or possibilities, what can happen in digital healthcare. We have a lot more exciting podcasts to come.